My name's Clare Ramsden. I'm the Executive Director of Allied Health here at Hospitals South in the Tasmanian Health Service. So my role as Executive Director of Allied Health is twofold. It has an operational leadership role, so I'm operationally responsible for Allied Health Services here at Hospitals South. I also have a professional leadership role and an executive membership role, which works alongside the Executive Director of Medical Services and the Executive Director of Nursing and Midwifery to ensure we have high quality professional standards across our workforce. Allied Health Services at Hospitals South encompasses 10 disciplines from Allied Health. So we are occupational therapy, physiotherapy and social work, podiatry, psychology, nutrition dietetics, speech pathology, audiology, orthotics, prosthetics and chaplaincy. And those 10 disciplines operationally report to the Executive Director of Allied Health and provide Allied Health services across the spectrum of services provided in Hospitals South. So that's from the moment that somebody arrives in the emergency department and sometimes before they arrive in the emergency department, throughout their admission in acute and subacute areas, in rehabilitation, and then post-admission as well through our outpatient and our community-based services. One of the unique things that I think we do here at Hospitals South is our ABLE program, which is Allied Health Building Leadership Experience. We recognised a few years ago now, probably 5 years ago, that one of the challenges for Allied Health being more embedded and equal in the hospital leadership and management teams is that Allied Health are often seen by the rest of the organisation as a single entity, whereas we see ourselves as individual disciplines. And that's a challenge for people who would like to step into leadership roles in Allied Health, is how do you step from being senior in your discipline and become a leader in Allied Health? And there's no course for that, there's no real training for that. So we built this program to be something that's delivered entirely internally. So we do it on a zero budget. We deliver it from our own expertise and people are able to join. This year we have around 24 members this year who are doing the course. This is our 4th year running it. So we're building up to about 80 people who've completed the course. They go to seminars once a month that are presented by our senior staff, and they have the opportunity to have a mentor who's an Allied Health leader. We talk about how you engage in meetings, working groups and projects as an Allied Health representative, and how you might be able to be a representative for something that is so really diverse in terms of the group of sort of disciplines that might be there. And then there's a 6-month period of practice where you get a chance to go and observe meetings and then attend meetings as an Allied Health representative as well. And we've found that this has been really important for us in having a pathway for our staff to engage in more Allied Health representative work, to have high quality representatives at all levels of the organisation, including some of our statewide clinical networks, as well as our senior meetings in the hospital. And then having people with a shared vocabulary around what it means to be an Allied Health representative and how you go about doing that, and mentoring people into the future to step into that. So I'm really proud of that program. It's really set us up very well to be a more integrated part of the leadership in the hospital. Allied Health's workplace culture, I think, is an exciting and dynamic place. And what I really appreciate working in Allied Health Services specifically is the enthusiasm, the creativity and the willingness to collaborate across the entire health service to really work for our community, for the people in our community, and to provide the best possible care that we can. And I think the other element of that, whilst being professional and providing really high quality services, is around fun and around making sure that the workplace that we come to work at every day is enjoyable, and that we all get together and we enjoy the work that we do. We're here by choice. Sometimes our people that we work with, our patients and consumers, don't always have a choice to be here, but we do, and we have a choice to bring our best to that workplace every day. Measuring productivity is really essential to us delivering an efficient, appropriate, high quality health service for our community, for allied health services and for our broader organisation. For allied health services, there is no single measure of productivity. We are a collection of disciplines, so what is a good measure of productivity for one discipline may not necessarily be something that works for another. And core to our work here at Hospital South is that allied health services is an integral part of health provision, along with nursing and medicine. So we are very much engaged in a very collaborative model of care that respects and engages all of the clinical practice. So that makes it quite difficult to disentangle sometimes the particular responsibility for an aspect of productivity. So pulling out an allied health measure of productivity can be a challenge. However, I think it's really important for us to identify as allied health services where we contribute to broader productivity measures in the hospital. So that might be around length of stay. It might be around hospital-acquired complications. If you take something like falls or delirium, we can have a significant part to play in the management and reduction and risk mitigation around those hospital-acquired complications. So where we are really adding value, I think, is by embedding ourselves in the broader organisation and being part of the collaborative work towards greater productivity measures as an entire hospital service. Earlier this year, we had a statewide Allied Health Services Day. So this was for the Allied Health Services teams from Hospital South, Hospitals North and Hospitals Northwest. We used to get together like this a little bit pre-COVID, but those meetings had not occurred for a little while. So this was a great opportunity for us to all be together in the one room. So we all, as senior leadership team, met in Launceston. We're very lucky to have our Deputy Secretary, Brendan Doherty there, the Chief Allied Health Advisor, Kendra Strong, and we had a fabulous opportunity to have Brian Dolan present. He was engaged with Hospital South, with the broader Tasmanian Health Service at the time, talking to us about end PJ paralysis and some of the work around avoiding deconditioning in hospitals. So we had a fabulous morning learning a lot from these three people, and then we spent the afternoon thinking about what this would mean to us in our various disciplines as allied health as a whole, in our regions, and what we would take back and implement. And it's been really exciting getting to see some of that work get underway. Recently, we've been able to implement some allied health scholarships, and this was the work of our Chief Allied Health Advisor, Kendra Strong, and the Minister of Health, working collaboratively to establish scholarships for new graduates to come and work in Tasmania across the state. It's been a fantastic opportunity, I think, to identify allied health workforces where we sometimes struggle to recruit in Tasmania. We don't always have the training programs here in the state, so we need to import people to come and work in this beautiful state. And the scholarships really enabled us to target high quality graduates who are really interested in coming and working in the Tasmanian Health Service and with our communities. It's given us an opportunity to identify, I think, what we really do well here. So if I think about podiatry, for example, we have a large number of our podiatry workforce who are credentialed podiatry prescribers, and that's quite attractive for a new graduate to come. And we were really successful in recruiting some new graduate podiatrists through our scholarship program. We also have an opportunity here, I think, as the single tertiary public hospital in the state to really give people an opportunity to experience a very broad range of presentations and workplaces, and it's an opportunity to gain a breadth of experience for a new graduate that you might not necessarily get in a larger hospital, and opportunities to step into allied health representation roles, mentoring roles, leadership roles that may come a little earlier or have different opportunities to than in a major hospital. Having worked in allied health now for, coming out 20 years, it's been a fantastic opportunity, I think, for me personally to have a very wide range of experience in lots of different settings, all with my allied health lens. So I've been able to work in a number of countries. I've worked in the UK and New Zealand and here in Australia in a couple of different states in different settings with different patient cohorts. I've been able to engage in research, I've been able to engage in quality improvement, and I've recently, well, not that recently, stepped into leadership roles. And I think allied health really provides a very broad career for people who are interested in almost any aspect of health service provision. When we are here in Hospital South, it's really important to us that we have opportunities for allied health services staff to really make the most of where their interests lie, whether that's in clinical leadership or extended clinical roles, whether it's in management and formal leadership, education and training, workforce development, quality improvement. I think there are so many parts of allied health that are meaningful to creating a health system that's the best that it can be for the community and really making a difference in individuals' lives.